All right, let's talk about the female anatomy. As with the males, we'll start with the gonads. The gonad is right here, the ovary. Okay, so this is the sex organ, if you will, that produces the sex cell, the gamete, and the sex hormones. So this is the ovary, right? One of two, one on each side. Here's the fallopian or uterine tube. Okay, this is called the fimbria, the little fingers that receive the ovulated egg. So every 28 of a 28-day cycle, every 14th day of that 28-day cycle of a woman who has regular cycle and is not on any chemical birth control, she will ovulate an egg. It'll actually blister out of this ovary. It'll explode out here. The fimbria will catch it, and it'll start traveling down the fallopian tube. Okay, so if intercourse happens and the sperm is ejaculated, it has to come all the way up through the vagina, through the uterus, into the fallopian tube, and fertilization usually happens way up here in this bend of the fallopian tube right here. And if that happens, then an ovum is formed and it travels through the fallopian tube, and if it implants, a pregnancy begins. Okay, so ovary, fallopian tubes. This is the uterus or the womb. You can see this very strong layer of muscle here. This is called the myometrium of the uterus. And then the inner lining is called the endometrium. Okay, the endometrium has two parts to it. It has a basement structure called the stratum basilis. That stays the same and doesn't change much. And then it has this other functionalis structure, the stratum functionalis. This is what grows every reproductive cycle. It is a rich part of the uterus that is ready to nurture a developing ovum and embryo if it forms. And if a woman does not get pregnant, it is the stratum functionalis that sloughs off and passes as menstrual flow. So every cycle, the stratum functionalis builds up and it gets cut down and passes as menstrual flow if a woman doesn't get pregnant. Now, this can grow out of control, and that's called endometriosis. Endometriosis can be excess growth of the stratum functionalis, and it can grow into the fallopian tube and plug the fallopian tube, preventing a pregnancy. Sometimes, if it's plugged up, a pregnancy can happen, but a fertilized ovum can happen, but it can't get out of the fallopian tubes, and that creates trouble. That's called a tubal pregnancy, an ectopic pregnancy, and we have to go in, and it's a serious situation. This fallopian tube is going to have to be removed. And so a woman is not sterile. She still has another fallopian tube, but it's not a good sign. Endometriosis can cause a woman a lot of pain. The stratum functionalis, the endometrium, can grow even outside of the uterus. Okay, so it can affect the fertilization. It can affect the pain of a subject as well. Sometimes doctors will put women on the birth control pill just to control their endometriosis. So that's the uterus. At the end of the uterus, the transition between the uterus and the vagina is called the cervix. Okay, and there's an opening to the cervix. So when a woman is pregnant and the health professionals try to determine how far along the baby is, they'll measure the opening of the cervix. Okay, and they'll determine how far the cervix is dilated. They'll do that by placing a finger inside the vagina and feeling the opening of the cervix. But I said this early in the semester, it turns out the cervix has to flatten out, nice and rounded here, has to flatten out before this can dilate more and the baby's head can start coming out. Anyway, that's the cervix. Here's the vagina. Notice the bladder right here, and here's the urethra of the bladder. There's a separate way that urine exits females as opposed to males. But you can also see the bladder. When a woman gets pregnant and a fetus starts growing in here, it pretty much squishes the bladder. And this is why a woman who's pregnant really has to go pee often. Okay. All right, now we're down out of the vagina, and we have the two sets of lips. We have the inner lips, the labia minora. These are the ones with no hair on them. And the inner lips, if you will. And the labia minora. The labia majora on the outside. These are the ones that do carry the pubic hair. Right? Labia minora, labia majora. And then, of course, we have the clitoris. The clitoris is homologous to the glans penis. There's something called the glans of the clitoris, which is at the very end, and of course the most sensitive area. And it actually is covered by a little sheath of tissue, just like the foreskin of the penis, called the prepuce. All right. What's not on these slides are some glands. I'll go over those in the next slide, but I think that pretty much covers the basics of female anatomy.